The gastritis is the inflammation of stomach lining, that's mucosa. It's either acute, that occurs due to sudden onset, or it's chronic, that's long lasting. The acute gastritis happens suddenly and symptoms appear quickly. And most of the causes of acute gastritis is the NSAIDs, alcohol, stress, bile reflux, and smoking. Whereas chronic causes are mostly due to Helicobacter pylori infection, but can also be due to autoimmunity and chronic use of these drugs. Now let's see the acute gastritis in detailed manner. Here in this diagram we have the surface mucous cells that forms as the mucosal lining. Then we have mucous layer, and beneath the lining we have the submucosa and muscularis layer. Now to start the process, first we have the mucosal assault. This assault is triggered by agents such as NSAIDs, alcohol, and stress. These factors weaken and disrupt the protective mucous barrier. The NSAIDs reduce prostaglandins, alcohol dissolves the mucus, and stress suppresses mucus secretion. Together they cause a breakdown of mucus layer and expose the epithelial surface underneath. Once the mucus layer is compromised, acid from the stomach begins to penetrate the surface cells as shown in the diagram. This acid infiltration leads to injury, irritation, and inflammation of the mucosa. At this point, the stomach's protective mechanism fails. The mucus layer dissolves and the HCO3, that's bicarbonate buffer, is lost, allowing acid to directly damage the epithelium. After that, we have the microvascular ischemia phase. When mucosal blood flow decreases due to reduced prostaglandins and increased vasoconstriction, the cells become hypoxic. Hypoxia leads to lactic acidosis, further damaging the tissue. The acidosis acts as a strong inflammatory signal. Then we have the neutrophilic inflammation phase. We see the acid injury, mucosal breakdown, and local acidosis together trigger neutrophilic inflammation. The damaged cells release DAMPs, that's damage-associated molecular patterns, TLRs on the immune cells get activated, and mast cells undergo degranulation, releasing histamine and other mediators. All of these signals promote recruitment of neutrophils into the mucosa as shown in the animation. This neutrophilic infiltration is the hallmark of acute inflammation in acute gastritis. Now once this acute inflammatory response is initiated, we immediately move into the next phase of injury, which is oxidative tissue damage. At this stage, the activated neutrophils begin to release the barrage of reactive oxygen species, that's ROS as shown in the diagram, and proteolytic enzymes. These oxidants act like chemical weapons, further injuring the epithelial cells and significantly deepening the mucosal damage. As the damage expands, it triggers inflammatory amplification. The injured tissue releases a surge of cytokinase and chemokines, which amplifies the inflammatory signal. With this continued inflammation combined with gastric acid exposure, the mucosal surface eventually starts to break down, leading to erosion formation. This results in superficial mucosal erosions, where the epithelial layer is completely lost. However, if these erosions extend into superficial blood vessels, we encounter hemorrhagic complications. The vessels rupture, causing mucosal bleeding as shown in the diagram. And finally, all of these microscopic pathological events manifest in the patient as distinct clinical symptoms. The individual will typically present with epigastric pain and burning, alongside nausea, vomiting, and bloating. So this is all about acute gastritis. I hope you like the video. If you like it, give it a thumbs up. Do support me work on Patreon or YouTube and make sure to subscribe to the channel. Thanks.